Bore da, and thank you, Commissioner, for the invitation to take part in today's event. I was going to suggest actually that we scrap this part of the seminar and we just listen to Margaret, because I could listen to Margaret all day. I think she was absolutely inspirational. But unfortunately, you're going to have to listen to me for a couple of minutes. So I'll try and keep my my comments short so that we can have a good debate and discussion later. The report that you've produced, Helena, has given us some real food for thought, and I was really pleased to be able to invite Helena to a recent meeting of cabinet members for social care from across Wales, where we discussed the report and some of the implications for local authorities across Wales. Undoubtedly, the pandemic has shone a brighter spotlight on mental well-being and mental health services. Councils have always had an important role in improving and maintaining people's mental wellness from childhood to old age, but COVID has proven the value of this more than ever before. In particular, cabinet members were keen to stress the need to intervene early to tackle loneliness and social isolation, and that was wonderfully articulated by Margaret. The pressures that the national lockdown and now local restrictions have put on people, particularly people that live alone or have caring responsibilities, have been huge, and we need to be vigilant around ensuring that we support those people and take the impact of that into account when decisions made around restrictions in the future. And whilst the focus of today is on recovery, I think the recent rapidly growing number of cases in Wales and the local restrictions that are now in place across most of Wales is a warning that this crisis is not over. The pandemic is not over. We may be facing our worst days, unfortunately, and we are going to have to learn to live with this virus, and councils are working hard to try and do that. We've obviously had a key role around the developing the tracing teams, supporting vulnerable people, ensuring that businesses comply with the public protection rules, and reopening services and reopening them safely to our communities. So we've been at the forefront of the response to COVID, and we'll continue to do that. And older and vulnerable people have been our highest priority, and we've made some difficult decisions around services, but always when we've made those decisions, we have put the health of our communities first, and that has resulted in some difficult decisions and some trade-offs, and we'll continue to make those difficult decisions to protect people from a deadly virus. We are going to have to learn to live with COVID, and it'll be interesting to hear people's views and see their questions today on how we do that. And what we're going to have to try and do is make our people, our communities more resilient as we face future waves. And the report has highlighted a couple of key areas where we need to do that. So digital inclusion is vital now, particularly for older people, many of whom are still digitally excluded, and particularly if further restrictions are put in place. So there are huge challenges ahead for public services and communities in Wales, but we are well placed to rise to those challenges, particularly if we work with, and I'm really pleased that Rachel is here today, particularly if we work with the third sector, the voluntary sector, with our charities. They've got a vital role to play with us in ensuring that our communities are more resilient. And our communities need to be more age friendly, because that doesn't just benefit older people, it benefits everyone. The steps that are proposed and the action that we need to take is important for the whole of society, and that's why we're committed in local government to making that a reality. And COVID-19 is not a reason for us to not do that. It's a reason for us to accelerate our work. It's more important than ever that we make sure that our communities and our services are focused on the needs of older people, because the vulnerability and risk is serious, and we need to provide as much support as we can for it. Is going to be some very difficult times ahead.